We are truly lucky to be able to live in a city like Boston. We value things about our city like the professional sports teams that represent us and our rich history, going back to the beginning of the revolution of the 18th century. But at the same time, we have things that we should really value more than we do. In Boston alone, we have 2 hospitals in the top 20 list of best hospitals in the United States, and the number 1 children's hospital. We take for granted how lucky we are to have the hospitals and system that serve you and I, but does it really serve everybody like it's supposed to? I went to the Boston Medical Center in South Boston to try to figure out how well the system is working. The staff that I talked to all said that they became healthcare professionals because they simply wanted to help others, whether that was from experiences that they had lived through or just simply wanted to help people.
But just helping people, gives you satisfaction, so that's what I wanted to do since I was very young.
And I was exposed to medicine through some illnesses in the family, and I kind of saw the patient-doctor interaction kind of at play, and I kind of corralled my interest in science with the patient care aspect of medicine, and it kind of all just came together into being a doctor.
Next, I asked about how the reality of being a healthcare professional has lived up to their expectations. They spoke about how they felt overwhelmed by the problems that affect them, but they cannot change.
I've learned that a lot of the problems are way out of my reach, and so I often feel like I'm putting band-aids on a massive, massive wound that needs a much more complex solution.
Sometimes it's really hard. You take care of a lot of sick patients and sad cases.
After that, I was lucky enough to get a tour of an emergency room at BMC.
So this room in here is for pediatric resuscitation. So what that means is if a baby or a small child comes in who's in trouble, you can take care of them here. You can put the baby right in this area, and there's a warming light that helps keep them warm in this region here. Or if it's a little kid who's having trouble breathing or a terrible bee sting allergy or an asthma attack, something like that, we can take care of them here on this stretcher. And then right next door through this little hallway, we have a trauma room. And this is where you would take care of a patient who's maybe been shot or stabbed. They can be taken care of right here very quickly, and you can get an IV started. These machines over here help start somebody if their heart stops working.
Lastly, I asked for them to speak about something that they would want to change at the hospital, or the entire health system as a whole.
Support universal health care, because it makes me really sad that people don't have good health care insurance and feel like they can't get good primary care. And so by the time they end up in the emergency room, sometimes they've got really terrible medical problems that didn't have to get as bad as they were. And if they had better preventative care to begin with, they wouldn't end up in the ER. I just had a lady on my last shift who had a heart failure problem, and her family actually flew her from California to Massachusetts because she didn't have any health insurance, and they thought she'd be able to get better care here in Massachusetts. And it just seems crazy to me that people go to those lengths because they don't have health insurance.
I think we're very governed by bureaucracy now. Administration that doesn't work in the field, telling the entire medical world how to take care of patients, and they really have maybe worked in it for a year or two, and now all of a sudden they're directors, which I can't figure that out. But that would be the only thing.
I know that in Massachusetts we're lucky to have universal health care, but that's not the reality for everyone in the U.S. And I think that is something that we really need to work towards. And just thinking about people being removed from that right now is very scary, because I know that is something that it will change people's lives. A lot of people go into bankruptcy and things like that because they don't have health care, so it will be very important for people to have that.
They spoke about how the system feels almost rigged, and how the people higher up do not have any idea about what it's like to work in the positions that the doctors and nurses have to do every single day. But somehow they still make the decisions that make the doctors and nurses' jobs harder without knowing what it is like to work in those same positions. They also spoke about how not all people can get the care that they need and deserve if they get hurt. These days, in the political environment that we have, some people will not go to the emergency room because they are undocumented and are afraid that they will be deported if they try to get the medical care that they deserve. Nobody in the United States should have to be afraid to get the care that they need, no matter what the implications are.